So we're about to do probably the hardest part of the day is going to be the elbow joint. We're going to see, guys, there's 3 bones coming together, and they have to arrange themselves in such a way that we can take our elbow and you can do this. But watch what our elbow can also do. It would be easy if they would just do this. Our elbow can also do this. Makes it a little bit more complex where we turn our palm down and palm up. So you're going to see it's a little bit busy in this area. That's probably the hardest thing of the day. Not that it's impossible, it's just the words are a little bit new, and again, it's going to involve some repetition. So before I get to that, let's do the top part of the humerus, which would be the proximal part. That's the way I put it in your notes, the proximal part. We're on page 2, right?
Yeah.
Did anybody have any questions on page 1? I forgot to ask, I'm sorry. Anything on page 1? Okay. So on page 2, guys, the humerus, I listed out the landmarks of the proximal humerus first. Very easy. This round part right here, that's going to go to the glenoid cavity like that, this round part, you're going to call the head of the humerus. The head. So it's almost a complete circle. Now, same as last week, whenever a bone had a head, like the rib, right? The rib head, what's below the head? Neck. So, depending on your model, it could be variable. There is a little groove that goes around the head of the humerus called the anatomical neck. You guys got a good one. You point that out there. Take a look. Let me see what you got over there. Yeah, you guys got a good one. See this groove that goes around right there?
What did you hear? Can I see?
Goes all the way around. That's the anatomical neck. This is what you got. Yes, you got a pretty good one. See that ridge? It goes all the way around, like this. Mine's not that great. It kind of goes around like that. That would be the anatomical neck. Some, like I said, some models are good. Like that. So that is the anatomical neck.
Do we have to say anatomical?
You have to say anatomical, and I'll tell you why. I'm so glad you asked that. Check this out. This is a bone that actually has 2 necks. Usually the neck, like this anatomical neck, is under the head. However, the humerus is special. It has another neck right where my thumb and forefinger are. This they call the surgical neck. For this reason, when the humerus fractures, like a foot injury, somebody falling on an outstretched hand, let's say they fall off their bicycle and they put their hand out like this and the impact causes a fracture, usually the fracture occurs up here. So they call this the surgical neck. Anatomical neck, surgical neck. So this is the only bone that I know that has 2 necks. It's kind of special. But on an exam, you can't just say neck here because you got to be able to differentiate between the 2. So this would be the anatomical neck. This would be the what? Surgical neck. And again, it's more of a clinical. A clinical. Yeah, anatomical was that groove that goes around the head. Okay, and then the surgical neck is right kind of at the top of the shaft.
Is that here or here?
Sorry, this is here, left side. So this is our arm bone. This is the humerus. Thank you. I meant to show you. Okay. Down in the forearm, we're going to see there's 2 guys down there. Okay. So the head, anatomical neck, surgical neck. So guys, watch this. The head faces medially towards the scapula. So on the lateral side, on the outside, there's a big bump. It's on the opposite side of the head. So out here on the lateral side, this big bump. On you, it would be like out over here. It's really sore from breaking yesterday. Holy crap, man. I can't even touch it. It's so tender. So this big bump right here, this is called the greater tubercle. We're going to see 3 out of 4 rotator cuff muscles attached to this. So again, if you're doing like a lot of arm work, that type of thing, working out with your arms or exercising or that type of thing, this may be a little bit sore. So this is the greater tubercle. Okay. Now, that faces lateral. If you were to take your fingers and walk forward to the front, right here, there's another bump. It's not quite as big. That is the lesser tubercle. That faces anterior, that's on the front. Okay, so the greater tubercle is lateral. The lesser tubercle, anterior in the front. That's where the fourth rotator cuff muscle attaches to that muscle, to that bump right there. Okay? Greater tubercle is on the other side of the head of the humerus. The lesser tubercle is going to be on the front. Now check this out. Between the two bones, there is a groove. It's actually a pretty good groove. It's pretty impressive. This is a groove that has two names. Depending on what you call it, I don't care. The technical name is the intertubercular sulcus. So what does inter mean?
Inside.
Between,
Outside,
right? Means between. Tubercular means the tubercle. So this was the greater tubercle. This is the lesser tubercle. So it's between the two tubercles. Sulcus is a fancy word for a groove. So you can call this the intertubercular sulcus. The one that I like is called the bicipital groove. Right, we can call it the bicipital groove. For this reason, one of the tendons of our bicep muscle goes right through that groove. That's where it lives. It stays there. It's called the long head of the bicep muscle. So we call it bicipital groove. A little bit easier than intertubercular sulcus, right? The intertubercular sulcus name is good because it tells you where it is, because it really shows you where it is. Bicipital groove is just an easier word to remember. Whatever you like, I'm good with both of them, okay? What's this structure? The head of the humerus. What's this structure on the other side? Greater tubercle, the one in the front. Lesser tubercle. What's this structure right here with my thumb and forefinger on? Surgical neck, excellent. The other neck? Anatomical neck, outstanding. And then the groove in between? Intertubercular sulcus or?
Bicipital groove.
Bicipital groove, right? One of the tendons of the bicep. We'll see when we get to muscles. The bicep has two heads, two parts, a long head and a short head. That's why they call it biceps. The long one lives in here. Okay. So the proximal part's not that hard. You guys seem like you have it pretty good. So watch this, guys. On a long bone, this right here is called the shaft. So this long part right here, the main part of the bone, is called the shaft. So hold up your humerus for a second. Mine's a pretty good one over here. On the shaft, on the lateral side. How do I know the lateral side? It's on the side of the greater tubercle. See this bump and a roughness out over here? It kind of bows out a little bit. One of our muscles, the triangular muscle, anybody know what that's called over here? Not the tricep, that's on the back. We're close though, right next to it. The deltoid muscle, the point, the one has a point. That deltoid muscle, look what it does. It comes down about halfway down the humerus and it attaches to this bump right over here. That is called the deltoid tuberosity. So it has the name of the muscle that's going to go there. Okay? So this whole long part, what are you going to call this?
The shaft.
The shaft. The bowed out part on the lateral aspect, deltoid tuberosity. Again, look at your deltoid. If you know where your deltoid is, it's on the lateral side of the arm, not the inside of the arm. It's the lateral side. So you got to make sure that you're looking at the lateral aspect. Just turn it a little bit for me to the side so I can see from the side. Yes. No, a little bit higher and a lot by that right there. Yep, right there, and a little bit more on the outside. Go to the outside. No, the outside. There you go, right there. That right there. Yep, you got it, guys. Yep, just a little bit lower. Not doesn't go up this high. It's going to be more in the mid right where you are there. Right where you are. Okay. Anybody questions or comments on the proximal? Okay. Okay, so for this one, watch this. I need your attention up here. Don't even look at your notes for a little while. Just kind of forget the paper, and we'll go through the notes in a minute. I want to show you something. With the humerus, this distal part, between my thumb and my forefinger, this whole area is called the condyle. We're going to see the rest of the day, whenever you hear the word condyle, it's forming a joint. It's actually part of a joint. So if you take a look up over here, between my middle finger and my thumb, this whole region is the condyle. I'm just gonna put this over here for a second. So it turns out the condyle of the humerus is divided into two parts. So watch this. We're gonna do the first one. The lateral one, so how do I know I'm looking at the lateral humerus? I always look at the greater tubercle. It just kind of tells me where I'm looking at the lateral, and the head is facing medial. So watch this. If you go to the lateral part of the condyle, this knob right here, on this bone right here, it's actually a good one. This little round circle that's on the lateral part of the condyle, we're gonna call that the capitulum. Capitulum. Again, some of these words are a little bit tough. Capitulum. The one next to it, medially, it kind of reminds me like a spool that you would put thread on, right? That type of thing. This right here is called the trochlea. Okay, so that's the medial part of the condyle. Capitulum is lateral. Trochlea is medial. So that, everybody with me on that? So let me put it together for you. Take a look up here for a second. In our forearm, we have, would you hold that for a second? We have two bones in the forearm. The bone that is on the thumb side, we're gonna see, is called the radius. Anybody know what the one on the pinky side is called? Ulna. Okay, so let's look at the radius first. Thank you. So watch this, guys. This is what the radius looks like. We're going to talk about it in a minute, but I want to show you how it articulates with the humerus. So the capitulum was here. The head of the radius, Professor Dye's talking about the friggin' capitulum. The head of the radius looks like remember the breath mint, the certs, or like a lifesaver that didn't have a hole in the middle type of thing, one of these things? It kind of looks like that. So watch what happens. The head of the radius goes up to the capitulum like this. So now, when you bend your arm, the radius does this, so that we bend the elbow, we straighten the elbow, okay? See how it glides like that? To do this, okay? So the head of the radius sits on what part of the condyle? What's this called?
Capitulum.
Capitulum, right? There's no other word for it. It's capitulum. The other part of the condyle was the trochlea. So check this out. This bone is the other forearm bone. It is called the ulna. How do you find the ulna? Watch this. This little notch right here looks like the letter what? U. It's telling you, I'm the ulna. It's got the letter U on it, so you can't miss that. All right, this is the ulna. So here's what happens. This was the trochlea. This notch of the ulna has the same name as the trochlea. We call it trochlear notch. So it tells you the trochlear notch is going to articulate with the trochlea. So guess what happens now when you bend your forearm? The ulna also can pivot back and forth like this. Okay? Questions or comments on that? Because I'm going to add to it. It's going to get a little bit more complex. Okay? Capitulum gets the radial head. Trochlea gets the trochlear notch of the ulna. Now, if you're looking at the bone, you're going to see this. Above the capitulum, there's a little indentation. Above the trochlea, there's a deeper indentation. I want to show you those first. Let me just see one thing for a second. So watch this, guys. This is the capitulum here. Here's the trochlea. It's a little bit bleached out. This is a little bit of a bright light on here. You have these pictures in your book. But watch this. When you bend your elbow like this, the head of the radius would hit the shaft of the humerus, and we would only be able to bend our arm maybe this far. So what's developed here is a depression so that the head of the radius can go into that depression, and instead of bending your forearm this far, we can go a little bit further. Same thing on this side. This is a deeper depression. It's a little bit hard to see. The front part of the trochlear notch has this point right here. This point we're going to see is called the coronoid process. When you bend your elbow, the coronoid process would hit the humerus, and again, we would only be able to bend our forearm this far. So this depression developed there, so this point can go into that depression, and now we can bend our forearm even further. So, let's go back. So now this time I'm going to ask you, because I've said it a couple times. What's the lateral part of the condyle that articulates with the radius? Capitulum. Okay? I'm going to put the head of the radius on here, like that. So what we're going to watch now is watch the head of the radius. When I bend it up, the head of the radius about here would strike the humerus. So there's a depression so that the head of the radius can go into that depression. This one doesn't fit there. We call that depression the radial notch. It receives the head of the radius when we bend our forearm, okay? So that it's not that deep, and you'll see it on your humerus there. It's a slight depression. It's called the radial notch. Let's do the other side. What's the part of the condyle that's medial that holds the ulna? Trochlea. Trochlea. It's going to receive the trochlear notch. So here's what I want to show you. The front part of the trochlear notch, this little point right there, see that kind of pointy part? It's the front part of the trochlear notch. What's going to happen is this. When you bend your elbow, that point, like right about here, would hit the humerus. That's as far as you would be able to bend your elbow. So what developed there is this depression that receives that coronoid process so that you can bend your elbow further. So we call that depression the coronoid fossa. It receives the coronoid process. So guys, this depression here, above the capitulum, radial depression, this depression here that receives the coronoid fossa, radial fossa, coronoid fossa, capitulum, trochlea. So those four things we see on the front of the humerus. And I'm going to add to it a little bit more. It's like I said, it's tough. It's a hard thing. Anybody questions or comments? Actually, I don't even hear any comments. I just want the questions. Forget the comments. Yeah. We haven't talked about that yet. We haven't talked about that yet. We're going to talk about that in a minute. So far, all we talked about was the capitulum and the trochlea. We haven't talked about this yet. We're going to go there in about 2 minutes. So watch this. This is what was just taking place on the front of the elbow. If we turn the forearm around, I'm sorry, not the forearm. If we turn the humerus around on the back, above the trochlea, we're going to see another depression on the back of the humerus. It is one big depression. It's centralized. On the front, we had two little ones sitting side by side. In the back, we had this big depression here. So watch this. If I put the trochlea on and we're looking at the back now, this back part of the trochlear notch is the prominence of the elbow. From lab number 1, what do we call the back of the elbow area? Olecranon, good. This is the olecranon. So guess what we call this big chunk of bone back here? This is the olecranon process. It's the back part of the trochlear notch. The front part was the coronoid process. This is the olecranon process. So here's what happens here. When your elbow is bent like this, the olecranon process sticks out like this, like that, right? When you go to straighten your elbow out, right about here, the olecranon process would strike the humerus, and you would only be able to straighten your elbow out this much. You'd be walking around like this. So what developed there is a big depression to receive the olecranon process so we can straighten our elbow out all the way. So this but this depression right here is the olecranon fossa. It receives the olecranon process. Okay? So these depressions have the name of what they're receiving. Radial depression in the front, radial fossa in the front, coronoid fossa next to it. On the back, see if I have it right here. This is the back, guys. This is the olecranon process. It's going to go into the olecranon fossa. Even when I look at these bones real quick to teach stuff, I'll always look for the greater tubercle lateral. I usually look for this to tell me it's the back, so I know, that I'm holding it the right way, when I'm trying to demonstrate. So this is a good way to tell that you're looking at the back. It's just a big depression right here. That's the olecranon fossa. Olecranon fossa.
And the process?
Which one?
The process, olecranon process?
The olecranon process is this right here. That's on the ulna.
Okay.
Thank you, on the ulna. We're going to talk about that in a minute. Okay? Yeah, I know this is tough. So that, to me, that's always the hardest to get through, to just get the parts. And then in a couple minutes, I'll give you time to sit around and play with it and try to get it together. Like I said, you got to try to figure it out. That's how you're going to remember it. So the last two things. This is what you were asking about. Just outside, if this was the condyle between my thumb and forefinger, just outside of the condyle, we have two big chunks of bone. Here where my pointer is and where my thumb is. These are called epicondyles. So listen, what does epi mean? Outside or upon the condyle. So they're saying the bone outside of the condyle, if my thumb and forefinger are the condyle, I'm going to put this bone here. I can't even do that. I have enough hands. I can use one more hand. Here we go. So this here, that is the lateral epicondyle. Look at this big guy here. That is the medial epicondyle right here. Again, epi means upon the condyles, so they're just outside the condyles. These two things, guys, are important anchoring points for muscles that we're going to learn. We'll see that your forearm muscles in the front attach to this big bone over here, and your posterior forearm muscles attach to this little bone over here. Did you guys ever hear a tennis elbow? When somebody has tennis elbow, the forearm muscles in the back of the forearm rip away from the lateral epicondyle, causing tennis elbow. Golfer's elbow is when the flexor side, the front forearm muscles, rip away from this big bump. Okay, so the big bump is the medial epicondyle. The smaller one out here, lateral epicondyle. And again, it's in line with the lateral, with the greater tubercle up here, which was lateral. Okay, the medial epicondyle is in line with the head, which faces medial. Feel it on yourself for a second. Go to your humerus, your distal humerus. If you kind of just grab here and here, right there, feel that medial epicondyle is freaking gigantic. You can't miss it. You can't miss it. Just a big, big chunk of bone. And all this is medial epicondyle, like that. Okay? Last thing on the humerus. So, this, I guess from the medial and lateral epicondyle up, there's kind of like a sharp edge right here. Some muscles start here. These are called the supracondylar, ridges or edges? Ridges. And some people call them edges, ridges. So this right here, this kind of like the sharp edge right here, this sharp edge right here. These are the supracondylar ridges. Right? We'll see some muscles attached there, the brachioradialis. There's a couple different muscles attached to that. Okay? This is tough. This is again, I see students too. That's just at a practical. They're looking at it, just trying to figure it out. Got to look at it frequently. So yeah. So watch this. The medial epicondyle was here. So this ridge going up, this would be the medial. Lateral epicondyle was here, extending up. This would be the lateral. Okay. So it goes with the names of the epicondyles. Very good. Okay. Got them all. Okay, let's look at now, so let's look at the two forearm muscles. Good news is some of it we've gone over already. So let's pick up the ulna. You show me which one is the ulna. Lift it up. How do we know again? Letter U. You can't miss it. So we got this letter U right here. This is the ulna. Let's take a look at some of its landmarks, guys. So we said before, this was the trochlear notch. So the back part of the trochlear notch, forming the prominence of the elbow. What would this be? Olecranon process. Good, the olecranon process. This whole big thing, right, that sticks out, the prominence of the elbow, all this is the olecranon. What was the pointy thing up over here? Coronoid process. That was the thing that went into the coronoid fossa, right? So olecranon process in the back, coronoid process in the front. And again, the coronoid is nice and pointy. Now, the next one I did not talk about yet. If you took your finger from the coronoid process and you go down like this, there's like a little bit of ridge of bone. This is called the ulnar tuberosity. Ulnar tuberosity. It's just a little bit of a ridge of bone. One of the muscles, the brachialis, attaches to that. So ulnar tuberosity. Okay, comes right from the coronoid process down. What was this big notch called again? Trochlear notch. We want to say trochlear notch because it reminds you that it articulates with the trochlea on the humerus, right? So trochlear notch and the trochlea sit together like that. I put it in the notes. I would prefer you guys call it the trochlear notch to remind you that it sits on the trochlea, but just be aware, you could call it semi-lunar. Some people call it semi-lunar because it has like a part moon shape like this, like a half moon. So that would be okay too. I just think it would be a good idea to call it trochlear notch so that you remember that it sits with the trochlea. Okay. So again, one more time. What's this? This back part is the olecranon. What's the name of the notch? Trochlear notch. The pointy part right up here. Coronoid process. From the coronoid, there's a ridge of bone coming straight down. This is the ulnar tuberosity. Good. I'm going to skip over radial notch for a second. Give me 1 second. We'll go back to that. What do you think the long part of the ulnar is going to be over here?
Shaft.
The shaft. Now, let's look at the distal ulna. This rounded part down over here, guys, this is the head of the ulna. It's down by your wrist at the other end. If you want to look at it, go like this. Mine's not that great. Some people have really good ones. They got like a big bump that sticks up in your above your wrist. That is your ulnar head. Okay? So that bump, when you look at somebody's wrist, that is the head of the ulna. Notice it's on the pinky side, right? That's where the pinky was. Okay? So the head of the ulna is down by the wrist. Now watch this. The last thing, this little point right there sticking down off of the head is called the styloid process. Remember we studied the styloid process on the temporal bone? It was like that little stick that stuck down? Same thing, a little bit of a stick. It's not that big, but that would be the styloid process. Okay. So the one thing I skipped is this. Watch me for a second. Pinky side is the ulna. The thumb side is going to be what bone? The radius. Just bear with me 1 minute. Right, I got one is left, one is right, but this should work. So the two bones in the forearm, they do this. They sit next to one another like this. So the head of the radius, which we're going to look at in a second, when it sits up against the ulna, needs a place to rest its head. So there's a notch just on the inside, or sorry, just on the lateral aspect of the trochlear notch. There's another notch right here. On my bone, it's painted green. That's where the head of the radius will rest its head. Okay. Now I want to show you the head of the ulna. Remember we said that's down by the wrist. So the head of the ulna, we're going to see in a minute, needs a place to rest its head. So there's going to be a notch up here for the ulnar head. What do you think we're going to call that? The ulnar notch. It's going to receive the ulnar head. Radial notch is up over here, receives the radial head. The ulnar notch receives the ulnar head. Yep.
This is the right side.
That's the right way, yep. So watch this. Watch this example. I want you to pretend for a minute you are the radius. And I want you in your mind's eye to picture you laying at home on your bed. your head is on the pillow. So you're the radius, you have your head on your pillow in your bedroom. Can everybody kind of picture that? Now, somebody comes in and they lie down next to you, but they put their head at your feet. Their feet are on your pillow, and you guys lay up next to one another, and that's what this is. The heads are at opposite ends of the bed. Your head on your pillow, their head at your feet. So now there is a resting place for each head. The radial head, your head is going to go up against their feet on the radial notch. Their head, the ulnar head, goes up against your feet, the ulnar notch. Okay? So remember, the heads are at opposite ends of the bed. I've seen students try to put together like this. You know, they somehow make it work, but it's not like that in the body. The two heads are not on the same side, opposite sides. Okay? And that helps you. Just kind of picture you're the radius, your head is on your pillow, the ulna, their head is at the opposite end of the bed. Okay? The radial bone. So some of these landmarks we know already.